Well, on to other news now. Influenza, more commonly known as the flu, has affected most, if not all of us at some time or the other. Well, last night, Deputy Chief Medical Officer for the Ministry of Health, Dr. Delon Brennan, shared some tips about the flu, including the months when Bahamians should be extra cautious.
According to the Centers of Disease Control Prevention, it's a contagious respiratory illness caused by influenza viruses that infects the nose, throat, and sometimes the lungs. Now, last night we learned that the flu shot is in fact an effective safeguard against the disease. Dr. Brennan stressed this point.
But the thing to know is the vaccine, the injectable vaccine that we give out is not a live virus vaccine. So the vaccine itself cannot give you influenza. You can't catch the flu from the vaccine. Of course, your body does mount an immune response to it. So that's not to say that you can't have some pain at the site, that you can't get some redness at the site, or you may even get some mild fever that happens afterwards as well. And some people will interpret that as they got the flu.
And now tonight, he shares this breakdown.
So there are some years where the influenza vaccine will actually prevent 75 to 90% of cases of influenza. There are some years where it may not be as effective and it may just prevent somewhere around the 50% range. But either way, it is very effective in decreasing the number of cases that we see, number one. But also, even for those people who get the influenza vaccine, if they are exposed to influenza, then they tend to have less symptoms to go along with it. So they'll have less of the body aches. It'll last for a shorter period of time. So even with that, and they tend to have less complications, because one of the big things we worry about with influenza is not just you getting the disease, but it is you can have more symptoms to go along with it. You are susceptible to having pneumonias and other complicating infections. And if you have a chronic disease, then it only worsens that situation.
Dr. Brennan explained that influenza patients with chronic diseases are more likely to succumb to the ailments than others. In 2018, the Ministry of Health reported just under 50 influenza cases. 2 of those persons died. One of them, according to Brennan, was a man in his mid-50s with cardiovascular disease. That case supports statistics that indicate that males are more likely to get influenza than females. It also supports the statistics that point out that persons in their mid-50s are among the most likely to contract the disease. I'm Keisha Bethel, ZNS Network News.